I'm Dr. Kathleen Ross. I am very pleased to be here, and I want to thank the Walrus for hosting this important event and the Lancet and all their contributors for their work on this issue. This publication and conversation could not be more timely. So as you heard earlier, I'm the president of the Canadian Medical Association, but I'm actually also a practicing family physician working in the Lower Mainland in British Columbia. As my fellow panelists have made so clear, the evidence on the need to change has never been so apparent. As a family physician, my colleagues and I are witnessing firsthand the health impacts of climate change. And as we heard, climate change is a health threat multiplier for the most at risk. And this is including rates of respiratory and cardiovascular disease to climate anxiety. And I'll tell you that climate anxiety weighs particularly heavily on our youth. The climate change also impacts all aspects of healthcare through its effect on food security, as we heard, on housing, household economics, mental health, and chronic disease patients. And indeed, climate change is even shifting how and where healthcare is delivered. As you heard earlier, there was massive wildfire evacuations, and that impacted many neighboring provinces and territories as patients sought both shelter and care. And I can say that our healthcare system was really not prepared to cope with this emergency. My own hospital in the Lower Mainland supported patients from the Northwest Territories, and it was emotionally challenging for patients and their families to be treated so far from home and family support, but it also challenged the capacity of our local resources to meet the needs of our population needing acute care. This is all happening at a time when the healthcare sector is already under unprecedented strain, and that strain has and will continue to be made worse by the increase in climate change related illnesses and evacuations. And physicians and other healthcare workers are already stretched thin trying to keep this system afloat. And with record levels of burnout and many choosing to leave the profession altogether, we need to understand that the climate crisis is exacerbating the pressures on healthcare workers, both professionally and personally, as Dr. DeRosa stated. But this summer, it was really driven home when many of my colleagues were evacuated and several lost their homes altogether. So if we know that this is a time when the health workforce, support has never been more critical, we need to recruit and train new providers for the future and make sure everybody in Canada can get the care that they need. We need to take this seriously. So physicians we know are already trusted voices in health and wellness, and healthcare providers can become leaders in strategies to improve the impacts of climate-related health and wellness issues. We can continue to increase and share awareness of a national adaptation plan and share what we learn with administration, colleagues, and more importantly, with the patients that we care for. So, how do you get started on such a monumental task? But perhaps it's by ensuring that healthcare professionals have access to the information and training we need to meet those challenges. And examples of adaptation could mean learning about more evolving diseases and disease processes on top of the best practice to treat illnesses that are being exacerbated by climate change. Modification to our foundational medical training model, as an example, CanMeds for physicians is on the horizon, but we'll need to put in place infrastructure and support for those already in practice to increase their knowledge. Of course, in all of this, we must remember that our health system itself is responsible for 4.6% of our total greenhouse gas emissions. And while that doesn't sound like a great number, especially compared with bigger, heavier emitters, think of it this way. If we took the most recent government numbers on Canada's total greenhouse gas emissions across every sector, healthcare systems accounted for 30.82 megatons of carbon dioxide equivalent, and that's more than aviation and shipping. And this makes us one of the worst healthcare polluters per capita in the world. It's really important that government, physicians, and other partners transition to environmentally sustainable and climate resistant health system processes, everything from reducing waste to rethinking our healthcare infrastructure. If we could remove that many emissions from our atmosphere, we would directly help to slow climate change and mitigate the impacts that we're trying to deal with. We would become more resilient in the face of extreme weather events, and disruption from climate-related events can certainly disable critical health infrastructure, as we saw this year, exactly when it's needed most. So I know we wanted to talk about a few practical examples. So at a practice level, we can learn and adapt to, to local climate risks and look for our resources. Looking at sustainability on our individual practices and implementing such changes, relatively simple ones like eliminating exam room table paper, using LED light bulbs, leveraging virtual care to reduce greenhouse gases and transportation to get to care, utilizing sustainable energy wherever that's possible. We can educate our patients and provide more specific risk advice for chronic disease medications, particularly those with cardiovascular and respiratory illnesses, preparing them for wildfire season, the same way that we would for allergy season and cold and flu season. We can advocate for enhanced community level programs like cooling centers or free air conditioners for patients most at risk as part of the care plans that we put in place for patients. We also need to make sure that we're educating hospital administration and patients around the benefits of plant-rich diets, as we've heard already, and then role modeling these practices. We also need to, improve access to healthcare via active transportation and ensuring that we support time in nature, better for our planet and better for our health. Sharing our own individual actions as role models does have an impact, particularly if we share steps we're taking to personally reduce our impact, decreasing beef intake, moving away from gas, reducing short haul flights wherever that's possible. And of course, physician advocacy for health system change is equally important. Encouraging consideration of carbon impact and sustainability of our local hospital systems as we undertake quality improvement, increasing recycling, moving away from greenhouse gases that we use for anesthetics, medicines, medical equipment, taking a really close look at the carbon impact of our supply chain. And alongside that, looking upstream in our healthcare system to reduce the need for care in the first place. As an example, a healthier population via improved social determinants of health and screening for early disease prevention and management would help. Looking to such partners as choosing wisely to decrease unnecessary investigations and select more climate-friendly treatment. The most simple one I can think of is reducing meter-dosed inhalers in favor of dry powder inhalers. And healthcare providers advocating for climate change to be framed as a critical health issue would help to inform the general public better and accelerate the commitments we need from policymakers locally, provincially, and federally. Keeping green belts green, banning fossil fuel advertising, decreasing fossil fuel expansion in favor of sustainable energy resources are all examples of current physician-led advocacy, because we know action at all levels of the government is needed. It's to that end that the Canadian Medical Association is advocating for environmentally sustainable health systems in Canada with a focus to reach net zero by 2050 or sooner. As part of this, we're calling on a national climate and health secretariat that would help effectively organize and develop a pan-Canadian approach to address the impacts of climate change and health while achieving Canada's climate commitments. This would certainly include supporting initiatives to create those climate resistant and low carbon sustainable systems across our provinces and territories. This includes building that climate resistant health workforce with enough staff, enough capacity, and enough planning to really address climate emergency. It is really critical in my mind that we work to reduce our carbon footprint and mitigate extreme weather events. And if we do, I too am hopeful that we can save thousands of lives and truly build a healthier population. Thank you.